Namaskar. Welcome to this session on lifestyle medicine. Uh, we warmly welcome our expert on lifestyle medicine, Dr. Chitra Setya. As we all know, she is a very well-known gynecologist. She has got an experience of more than 40 years. She is also a diplomat, International Board of Lifestyle Medicine, States, America. So, if you all remember that she had touched upon the 6 pillars of lifestyle medicine last time. And I still remember very clearly, it was very important: nutrition, exercise, sleep, stress management, social connections, and de-addiction. So these are the 6 pillars she had focused on. And on popular demand, we have decided to request her again. Today she is going to touch upon one of the most important pillars of the lifestyle medicine, that is sleep. And before we start, I give mic to her. Very interesting thing happened today. I was in the clinic. I was referred. I was sent a patient from ophthalmologist colleague. Interestingly, she sleeps only during the daytime, from 9 in the morning to 6 in the evening, and she's awake all through the night. So very interesting. So, and she's 82-year-old female. And as we all know that because of one of the important cause being the digital, which is digital, we are so much involved with the digital world that it is really playing havoc with our lifestyle. 3 common things which happen with the sleep is: one, you do not get sleep for hours. Before you go into the sleep, it takes longer than usually, say 1.5 hours. Second is, sometimes you go to the sleep, but then you wake up very early, within 2-3 hours, and then you are unable to sleep. And third is, what happens? You get interrupted sleep. You sleep for 2 hours, then you wake up, then you again sleep for 2, fragmented or interrupted sleep. So I am very sure that this is going to be an enlightening one. I am looking forward to this session today by Dr. Chitra Setya. Welcome, madam. Please take over.
Thank you. Thank you very much. I'll just start sharing my screen. One second, I can't make the slideshow. Okay, so today, as Dr. Pata said, it's about sleep. What is sleep deficit is insomnia. Do we have a treatment for it? So today, let's go on to that. Before we read what is insomnia, let us understand what sleep is. Now, sleep is a physiological process that occurs in humans and in animals and is defined as a recurrent state of reduced attention to the surrounding environment. Sleep causes restoration of body functions, synthesis of proteins, and the prevention of lethargy. The number of sleep hours required varies from individual to individual. There may be disturbances in sleep status in the form of difficulty in falling asleep, waking up frequently during the night, with difficulty in returning back to sleep, and waking up too early in the morning, and an unrefreshing sleep. One second, let me just start the video. Yeah. Now, insomnia is the perception or complaint of inadequate or poor sleep status. Leg cramps, restless leg syndrome, and periodic limb movement are just some of the comorbid conditions associated with a poor sleep status. Now, there was a study in 2024 about Indian sleep quality and duration. And it was amazingly found that over 50% of elderly individuals reported poor sleep quality, and about 36% discovered experienced subjective bad sleep. Another study found that 37% of older adults had insomnia, and sleep duration. Some studies showed a significant portion of older adults who were sleeping for less than 7 hours, while others sleep more than 8 hours. Sleep latency. 34% of elderly subjects had a difficulty in falling asleep up to more than 1 hour. And you found that 42.3% were because of overthinking, 20% was about workplace stress, 6.7 was about drinking caffeine, 9% was about needing the toilet, or 21% were due to medical reasons for not getting sleep. Now, sleep plays a significant role in almost every system of the body, and insufficient sleep increases the risk in all these systems. Consequences of sleep deprivation include, right from the head, mental health disorders, immunodeficiency syndrome leading to autoimmune diseases and decreased immunity to infection, diabetes, cardiovascular disease, obesity, hormonal imbalances, as well as joint pains. Now, what induces sleep and what is the sleep control system of our body? That lies in our brain, which is in the center of the brain, the hypothalamus. And there is the suprachiasmatic nucleus. And your brain's master clock or the suprachiasmatic nucleus receives light cues from the environment. So light is very important as a deciding factor for your sleep. Now, what is the sleep cycle or the circadian rhythm? Now, there are different types of sleep. There is divided into N1, N2, N3, and REM sleep or rapid eye movement sleep. N1 is the time you're falling asleep. L2 is the light sleep, which you spend maximum of your night in. N3 is the deep sleep, which is one of the most important aspects of sleep. And REM sleep is the vivid dreaming, where rapid eye movement occurs. And this is also very important for your mental growth. And one thinks that one just falls asleep, goes into light sleep, goes into dark sleep, deep sleep, and wakes up. No, there are about 6 cycles of repetitions during the full night. Your initial lighter sleep is the end of falling asleep. Then you have the light sleep, you have the deep sleep, and you have the REM sleep. And you find that between 2 a.m. and 3 a.m. is your maximum time of light sleep and deep sleep and your REM sleep. And REM sleep increases towards the waking up period, 4 a.m. to 6 a.m. And this is very important, as I'll tell you the stages later on. Now, functions of the body. The sleep stages in a very different organism affects the body in different ways. N1, the body is not fully relaxed, though the body and mind begins to slow down. It's very easy to awaken, but can move into N2. N2 is the light sleep, where body is more relaxed with decreased temperature, relaxed muscles, slowed breathing and heart rate. Brain is more relaxed. There is a stoppage of eye movements, and it's very difficult to wake up the person at this time. Maximum time is spent in N2. N3 is the deep sleep, where muscle tone, pulse, breathing, everything decreases. Brain activity has the slow wave sleep. It is essential for restorative sleep and helps in insightful thinking and memory. REM sleep is the rapid eye movement, where the brain activity picks up now again, nearing levels seen when you're awake. This is essential for cognitive functions like memory, and vivid dreams occur in this phase. Body experiences atonia, that is complete muscle relaxation, with 3 exceptions: the eyes, the muscles that control the breathing, and the heart. Even though the eyes are closed, they are moving very rapidly. You do not enter an REM sleep until you've been asleep for about 90 minutes. And as I told you, there are about 6 times that you go through all these phases of sleep. And the importance of sleep stages, they allow the brain and the body to recuperate and develop. A failure to obtain enough of both deep sleep and REM sleep may explain some of the profound consequences of insufficient sleep. Sleepers who are frequently awoken during early stages, such as people with sleep apnea, may struggle to properly cycle into the deeper sleep stages. People with insomnia may not get enough total sleep to accumulate the time needed for each stage. What affects the sleep stages? Age. Time in each stage changes dramatically over a person's life. Newborns spend far more time in REM sleep and may enter a REM stage as soon as they fall asleep. That is why you find newborn babies. They are sometimes smiling, they are frowning, they are, you wonder what all dreams they are getting. And they're actually getting dreams because they are in the rapid eye movement sleep. And you find sometimes, if you notice them very carefully, they're fluttering their eyes. And as they get older, their sleep becomes similar to that of adults, and older adults tend to spend less time in REM sleep. The recent sleep patterns. If a person gets irregular or insufficient sleep over a period of days or more, it can cause an abnormal sleep cycle, and people start following that same sleep pattern. Alcohol. Alcohol and some other drugs, especially nicotine also, can alter the sleep architecture. For example, alcohol decreases REM sleep early in the night, but as the alcohol wears off, there is a REM sleep rebound with prolonged REM stages. So that is why they dream a lot. Sleep disorders, sleep apnea, restless leg syndrome, and other conditions that cause multiple awakenings may interrupt a healthy sleep cycle. Now, average sleep needs, if you look at the right side, newborns require about 16 hours. At about 2 years, it is about 12.5. 10 years, it is about 10 hours. Teens, it's about 9.5. And adults, it is 7 to 8 hours. Now, the sleep hormone is the melatonin, which is the night hormone, which is responsible for sleep. It inhibits the SERT, the sodium-dependent serotonin transporter, so which is a serotonin derivative, highest during the day and lowest at night. Bright light inhibits melatonin production. And that is why people who are exposed to bright light constantly have a difficulty in falling asleep. Now, what all does sleep deprivation cause? Common symptoms include daytime sleepiness, fatigue, irritability, trouble in thinking, focusing, remembering, headaches, and slowed reaction times. And some causes are poor sleep habits, stress and anxiety, medical conditions, shift work. In today's day, this is a very important factor in shift work. Substance use, medications, and environmental factors. Other factors like aging, the total sleep time decreases, sleep onset becomes delayed, increased daytime napping is there, increased awakenings and arousals, decrease in sleep efficiency, that is the percentage lying asleep in bed, increase in the stage 1 and stage 2 sleep, and decrease in stage 3 and REM sleep. Now, symptoms and warning signs. Seek evaluation if you experience difficulty in falling asleep or frequent waking, loud snoring or grasping during sleep, excessive daytime sleeping or fatigue, morning headaches and dry mouth, mood changes, irritability, anxiety, depression, poor concentration and memory problems, reliance on sleeping pills or alcohol to sleep, and waking unrefreshed despite adequate hours in bed. And did you know that 50% of insomnia cases are linked to anxiety or depression? Or that 80% of sleep apnea cases remain undiagnosed, and 40% of people with sleep disorders don't even realize they have a disorder. Common sleep disorders, what you come across are insomnia, which is difficulty in falling or staying asleep. And this is the most common disorder, affects 30% of adults. Then you have narcolepsy, which is sudden and uncontrolled episodes of sleep during the day. This leads to, or is usually due to, disrupted night sleep. Circadian rhythm disorders is misalignment of the body's internal clock with the external environment. For example, in shift work, jet lag, these are the two most common cases of circadian rhythm disorders. Then you have sleep apnea, repeated breathing interruptions during sleep causing oxygen drops and frequent waking. This is quite often seen in people with obesity, where there is a sudden drop of the head back, the tongue hits the throat, there is a sudden gasping, oxygen drops, and the person has to get up automatically. So you find in obese people, this forms a very important aspect of causing sleep disorders. Then you have the restless leg syndrome, uncomfortable urges to move the legs, especially at night, disturbing the sleep onset. Then parasomnias, Abnormal behaviors during sleep, sleepwalking, night terrors, REM sleep behavior disorders. Now, what are the remedies? We have to look at remedies for these sleep disorders. First of all, the environment should be dark, quiet, and cool. Habits like diet and exercise. Mental health, look after the mental health, limit naps as well as caffeine. Sleep schedule should be 7 to 9 hours, and there should be regular bedtimes. Not that whenever you feel sleepy, you go to sleep, the rest of the time you're awake. Improve your sleep environment and routine. Maintain a consistent schedule. Go to sleep and wake up at the same time every day to regulate your body's internal clock. Create a calming bedtime ritual. Wind down before bed with activities like reading, listening to soothing music, or taking a warm bath to signal to your body that it's time to sleep. You follow a particular protocol just before schedule, protocol, whatever you call it, before sleeping, so that your body has begun to realize that, okay, now it is bedtime. Like for children, we start teaching them, okay, now go and have a bath or whatever your schedule is, change into your night clothes, have your hot milk. There are certain routines which are followed in every house, and the child starts realizing, okay, now it's my bedtime. Optimize your bedroom. Keep it cool, dark, and quiet to minimize disruption. Consider using blackout curtains and eye masks to block the light, because light acts as an inhibitor of melatonin, which is your sleep hormone. Limit napping. Avoid long naps, especially in the late afternoon or evening, as they make it harder to sleep at night. Consider your phone and screen use. The blue light from devices can make it difficult to fall asleep, so avoid them for an hour at least before bedtime. Because blue stimulates melatonin, decreases the melatonin formation. The more you're on your phone, you cannot fall asleep. So there should be a consistent schedule. Go to bed and wake up at the same time every day, even on weekends. This anchors your circadian rhythm. A dark and cool room. Keep the bedroom between 15 to 19 degrees or 60 to 70 degrees Fahrenheit. Use blackout curtains or a sleep mask to eliminate light. Bed should be only for sleep only. Reserve your bed for sleep and sex only. Avoid working, watching TV, or scrolling in the bed. Wind down routine. Start relaxing 60 minutes before bed. Try reading, light stretches, or journaling to signal sleep. Limit stimulants. Avoid caffeine after 2 p.m. and alcohol within 3 hours of bedtime. Both fragment the sleep quality. Manage light exposure. Get bright light in the morning. Dim the screens 90 minutes before bed. Use blue light filters on devices. The best is, the moment you get up in the morning, expose yourself to the bright morning light, because it decreases the melatonin. It sets your schedule for the day that, okay, now it is morning, bright morning. So ensure that you look at the morning, expose yourself to the morning light. Adjust your diet and habits. Avoid caffeine and alcohol, especially before bedtime. Don't eat heavy meals before bedtime, because that can interfere with sleep. Snacking. Avoid snacking between meals, especially if you're sleeping late. Then after dinner, people, keep a packet of chips with them or some snacking they do, and that interferes with sleep definitely. A lot of my PCOS patients who come, youngsters, they are sleeping late. They are sleeping at 2 a.m., 3 a.m. And the parents say suddenly we hear a ring and it's Zomato or Swiggy who got burgers or chips or something like that. So there's a lot of eating going on later, and your body is in the rest mode. And at that time, you're making the body work. So all the wake up hormones are being activated. So this leads to a lot of hormonal problems also. So sleep patterns, ever since I've done lifestyle medicine, started taking a lot of history on sleep. And I find that a lot of people who have hypertension, who have diabetes, the youngsters who have PCOS, all have the sleep problems, which are affecting the hormonal cycle of your body. Early dinner, try and have dinner early, because that definitely helps in digestion. Then GABA, this is gamma aminobutyric acid. This is very, very important for, improving the hormone system of your body, especially the tryptophan and the serotonin, which are responsible for the melatonin production in the body. And this particularly, there is a loss from whole grain to polished grain causing insomnia. And nowadays, nobody has whole grain. They all have white polished basmati rice. You have maida, a lot of breads, and there's hardly any whole wheat. See, our grandparents or great grandparents or the people living in the villages don't have these problems because they're having a lot of fiber in their diet. And so all these really don't get affected. Foods that help sleep are cherries and walnuts, which are a natural melatonin source. Kiwi improves sleep onset and duration. Warm milk contains tryptophan and calcium. Fatty fish, salmon, rich in vitamin D and omega-3 fatty acid. Nuts and seeds have magnesium for muscle relaxation. Bananas have potassium plus B6 to produce melatonin. Chamomile or valerian root tea. At night, they say that, okay, instead of having coffee, if you want to have tea, instead of the nicotine-based tea, have the chamomile tea. Then foods that harm sleep are coffee and energy drinks after 2 p.m. Alcohol suppresses deep sleep stages. Spicy, heavy meals within 3 hours of bedtime. Dark chocolate, again, contains caffeine and stimulant. Sugary snacks cause blood sugar spikes. High-fat meals delay gastric emptying. Nicotine is a stimulant that disrupts REM sleep. Now coming to exercise. This is very, very important. Aim for 150 minutes per week of moderate aerobic exercise. Morning or afternoon exercise is best. A lot of youngsters, I ask them, okay, are you exercising? Yes, yes, ma'am, we're definitely exercising. When? 9 o'clock, we go to the gym. I mean, most of these gyms are now open till 11 p.m. And you find people are exercising at 9 o'clock, 10 o'clock, and that's absolutely the wrong time to exercise. Because all your wrong hormones, the body is trying to rest after 9 p.m. and here you're stimulating it. So all the wrong hormones get stimulated, and this leads not only to a delay in sleep, but it leads to a lot of your chronic problems. Yoga and Tai Chi have a strong evidence for improving insomnia and sleep quality. Even a 10-minute walk can meaningfully improve sleep at night. Now coming to stress management, very, very important. The 4-4-4 breathing, like a simple thing. I think all of you are following, just follow me. Inhale for 4 seconds, just close one nostril. 1, 2, 3, 4, inhale. Hold with both your hands, hold for a count of 4. So 1, 2, 3, 4. Now release from the other nostril, exhale over 1, 2, 3, 4. This you repeat about at least 10 times. Repeat this 4-4-4 breathing. This activates the parasympathetic system to reduce anxiety. Then progressive muscle relaxation. Before sleeping, just systematically tense and release each group of muscles from the toes to the head. Lie down calmly and start tensing all the muscles of the body. Just tense each one mentally and physically. Tense them and release them. Tense, release. Tense, release. A little bit of activity, you give all the muscles of the body, and you find the relaxation you get after this exercise. Then mindfulness meditation. Even 10 minutes of mindfulness practice reduces cortisol and improves the sleep onset significantly. Now, meditation or mindfulness, you think, how can you do it? Okay, so you don't have to concentrate. I mean, ideally meditation, they say focus on one point in your mind or on one axis and do all that. Sometimes people find it very difficult to do that. Just concentrate on your breath. Initially start with say 1 minute or 2 minutes by the timer. Just concentrate on your breath, just the inhalation, exhalation, inhalation, exhalation. First, if you feel you cannot do it for 5 minutes, practice for 1 minute. 1 week, you practice for 1 minute, then practice for 2 minutes. Gradually increase it weekly. You will realize that you are able to focus more and more and more. You're not allowing thoughts to flow over your brain. So even 10 minutes of this reduces cortisol, improves sleep onset significantly. Then cognitive behavioral therapy for insomnia, the CBT1, is what your psychologist will give you. That is for chronic insomnia. This addresses thoughts and behaviors that maintain pure sleep, but that is from the counselor. So when you are persisting with lack of sleep, please address your problems with a counselor. Now, stress sleep cycle, how important it is. High stress leads to poor sleep. This leads to impaired coping. This leads to more stress. So it becomes a vicious circle. Other assistance you can give is hydration. Dehydration could contribute to worsening, storing, and leg cramps, impacting sleep. Decreased fluid volume could also reduce peripheral vasodilatation, which is essential for core body temperature cooling, and inadequate hydration could impair sleep. Then music. A Cochrane database review in 2020 looked at music for insomnia and concluded that listening to music may be effective in improving sleep quality in adults with insomnia. But again, you should listen to soft, soothing music, not the jang, jang, jang jazz. Even though that may be something you like better, but slow, soothing music helps you to fall asleep better. Then journaling. This is another very important thing. A lot of people are just stressed out by what all they have to do the next day that they can't fall asleep. So the best is go to your table, sit down, write out 1, 2, 3, 4, 5, 6. Write down in notes what all you're supposed to do the next day. So take it out of your brain. You're not constantly thinking, okay, I forgot this, I forgot that. What if I forget this? So best to write it down. You know that you have it on your notes. You can just refer to that in the morning as to what you have to do next. So basically, if we come down to a summarization of the treatment, one is behavioral and psychological. This is through the counselors. The CBT1 is the most effective. Sleep restriction, stimulus control, and relaxation training. This has to be with your counselor and your sleep therapist. Then medical and device therapy, you have CPAP, BiPAP for sleep apnea. For those who have, obstructive sleep apnea, that they wake up because of obstruction, they need therapy. Then oral appliance therapy, light therapy, iron supplements for restless leg syndrome. See, most often the restless leg syndrome is due to anemia or due to some B6 deficiency. So this has to be replaced with medication. Pharmacological for sleep are melatonin, which is low dose and timing specific. Like a lot of people with jet lag, they are given melatonin for 2, 3 days so that the sleep cycle is rectified. Then prescription sedatives can be given, antidepressant, but always consult a physician. Don't take any of this on your own. What you can do is lifestyle and complementary therapy, sleep hygiene optimization, regular aerobic exercise, dietary modification, acupuncture, meditation, yoga. So how do we plan your 30-day sleep action plan? Week 1, establish a foundation. Set a fixed time, which is non-negotiable. Then remove the screens from the bedtime. All your TV screens remove. Track sleep with a journal or an app. Week 2, optimize the environment. Adjust the room temperature to 65 degrees Fahrenheit. Start a 30-minute wind down ritual. Reduce caffeine by 50% after noon. Then lifestyle integration in the 3rd week. Add 30 minutes of daily movement. Eliminate alcohol 3 hours before bedtime. Practice 10 minutes of evening meditation. Then week 4, you fine tune the whole thing, changes which you brought in, and maintain it. Assess what is working and adjust accordingly. Consult a doctor if issues are persisting, and commit to long-term sleep schedule. So sleep well, our aim is to sleep well and live well. Your path to a better sleep starts tonight. Prioritize consistent sleep and wake times. Nourish your body with sleep supporting foods. Move daily and manage stress proactively. Seek professional help for persistent disorder. Sweet dreams are built with science, habit, and a little patience. Thank you. Namaste.
There are questions in the chat box.
Okay, I'll just check that. Yeah. How can someone whose work involves night shifts only manage their sleep cycle? This is a question which arises each time, and it is a difficult answer because everyone can't be only on night shifts. They will shift to something later on, but with night shifts, then you have to manage your sleep according to your day sleep only. This we cannot help in. How can insomnia be managed in older adults without relying on sleeping pills? Here again, I told you, expose yourself to morning sunlight. All the factors, what I've shown you in remedies, you will have to do that. Or, of course, to some extent, for a short time, if they are absolutely not sleeping, then go to a sleep consultant and take advice from them. What are the three most effective habits people can adopt to improve their sleep? Um, One is the schedule. Keep an alarm. Maybe start with the waking up schedule. That is the most effective because sleep schedule is very difficult to make up initially. So best is switch an alarm on that you have to wake up at this particular time. Wake up, go outside, expose yourself to the morning sunlight, and gradually after 2 o'clock, stop your caffeine, stop your fizzy drinks, stop alcohol. This is another thing. Then diet, try and eat early and nothing after that, other than maybe you can have a glass of warm milk. That helps. And keep your room dark, and it should be a comfortable temperature. Try and have a warm bath before sleeping. And one very, very, very important factor, switch off your mobile or keep your mobile away and don't look at your mobile for 1 hour before you sleep. That blue light is the worst negating factor for melatonin. How much does screen time before bed actually affect sleep and what alternatives? Well, screen time, I told you, 1 hour before that, stop it. Start developing your affinity to reading books, listening to music. You can even do a slight bit of yoga and Brahmari pranayam. That is supposed to help. Sit in Vajrasan for some time. That definitely helps. What role in meditation and yoga? Definitely, almost as high as 30 to 40%. Meditation and yoga definitely helps. Is it safe to take sleep medication and for how long? It is safe for people who have a lot of problems, but for a very short time. Meanwhile, you change your lifestyle so that the medication can reduce. And consult your sleep specialist, consult your psychologist and counselor as to how long they should give you. They should take the sleep medication and never take sleep medication on your own. How is food intake and sleep related? Sleeping post breakfast leads to migraine. See, food intake, not post breakfast, but generally late meals start the digestive system functioning, and that is sleep time is the one where your gut and all the other hormones of the body are in a sleep profile, because your body also requires sleep. It is active constantly 24 hours, so it needs a sleep time to remove the wastage. And if you load it with food at that particular time, then gastric emptying gets delayed, your body feels full, so that fullness inhibits sleep. Then it increases the stress hormone level, the cortisol level, it increases the insulin, increases the sugar level. All these are sleep inhibitors. That should be enough. I think most of the questions are over.
Yes, I think most of the questions are over. Any other queries, any questions you want to ask the specialist? She's here. This is your chance to get them answered. One query from my side is limiting the napping, you said.
Yeah.
So, is there any fixed duration that this much minutes of napping is allowed?
Yeah,
Or
post lunch, after about an hour, immediately post any meal, you should not go and be flat. That is said to improve the digestion and improve your gut health. Okay, so at least for an hour, you should be vertical, not go down flat on the bed. So afternoon nap for about an hour is all right. But then wake up, put an alarm if you can't wake up, and get up, get out, do some reading, do something which you like doing. But, and in, constant scrolling on the phone, that also stimulates your brain because all the brain axis gets activated. And if you're reading, you're focusing on something. So your brain is in one calm process of focusing. But when you're on the phone, you're never focused because you're scrolling. So that is one very negative aspect of using the phone at night. And that's what we find in most of our youngsters because they say, ma'am, that's the time we get to chat with our friends and we do everything. I mean, they're not chatting as chatting, they are scrolling. So the brain, instead of calming down, is going to a very, very active state.
Another interesting thing which I have noted is when we were, kids, we used to have yellow lights on.
Yes.
I don't know
Now
whether
there's
that
a lot
really. Yes.
that was calming this thing.
Yes.
Similarly, another thing I would like to tell people is that don't switch the bathroom light on when you use the toilet at night. Keep a red light on, light, red light, not even blue light. A calm light, because the moment you switch on bright light, your melatonin level goes down. So your sleep hormone gets affected. So night, a lot of people go to use the washroom. And there, if they switch the light on, it becomes difficult to fall asleep. Secondly, restrict fluid intake after 2 o'clock, especially for the elderly. I would say restrict the fluid intake after 2 o'clock. I'm not saying dehydrate yourself, but a lot of people say we start feeling thirsty after 2. If you complete your hydration before that, like normally I try and restrict fluid intake after, say, 6 or 7. Try and restrict fluid definitely after that. Before that, we've had enough water so that you are adequately hydrated. You're not affecting your hydration, but restrict your fluid intake after about 6 o'clock in the evening so that you're not waking up constantly. People say, ma'am, तभी याद आता है. When we come back from office, तभी याद आता है कि हमें पानी पीना है. So I tell a lot of these youngsters, keep bottles with you on your computer table so that you remember, okay, that has to be finished.
Another important aspect, madam, these days in social media, you listen to a lot of people saying that magnesium tablets you should be having. Is Do you have any comments to make on that, or
I haven't got the question.
magnesium? They say magnesium tablets you can
Magnesium.
have. Magnesium.
Magnesium is good for the restless leg syndrome. It calms your muscles.
Okay.
So that is how it helps. So a lot of people have muscle cramps, and that is why the restless leg syndrome comes in. So magnesium helps in that. And if you have, again, you don't need magnesium supplementation. There are a lot of natural foods like bananas, nuts and seeds have a lot of magnesium. So if you regularly have that, that helps. Initially, you can have some magnesium tablets. And once that is rectified, have it in natural foods.
Thank you very much, madam. Extremely grateful. It was the most important topic. And one important aspect which I have learned by listening to you is we have to go to the bed at the same time every day.
Yeah.
Every day. That's a very important. I think one of the most important aspects of the sleep hygiene, if we need to follow this.
Yes. The
Can I
schedule.
ask, sorry, can I ask one question?
Yes,
Yes, please.
sure.
Just now you said that the
Why don't
magnesium.
you switch your video on?
Okay, just wait. Is it okay now?
Yeah.
Yes, yes.
So they say that you just mentioned that we should take in natural form the magnesium. Is cocoa a natural form of taking magnesium? Cocoa powder without sugar?
Powder, no. It has a part of caffeine also. No?
Cocoa doesn't have caffeine, or it
No.
has atta?
It
Cocoa
has
is okay. Okay. No, it's from the beans, the cocoa beans.
cocoa beans.
Huh.
Yeah, but that also has a bit of, say,
Okay.
I'll have to look it up, the
Okay.
exact content of each.
Okay, okay. Because I read somewhere, I just wanted to therefore ask this question, that cocoa has got a lot of magnesium.
But it has caffeine also.
Okay.
So again, all these.
I know there are so many ifs and buts, it's very difficult. I think one has to first learn about the body, what it requires, and the
Yes.
pattern that you should be doing, you have to do, and then decide. There cannot be any
Yes.
hard and fast.
That's why I said follow weeks like
Yeah.
schedules, so that learn what your body wants and
Yeah.
then correct it.
Yes.
Can I say something?
Yes,
Yeah,
sir.
yeah.
Please.
See, I personally think that our social media and something becomes a fashion. For example, magnesium these days has become a fashion. 10 years ago, it was vitamin D, right? Prior to that, it was something else. What I want to stress upon is that these chemically derived magnesium tablets, or even for that matter, calcium, all these chemically synthesized tablets would have one or the other side effect. It may not be adverse, but it is there. For example, calcium is a gastric irritant. If taken in high doses, or if taken regularly for some time. And unfortunately, the social media push, the fashion, and the pharmaceutical industries push to get more money. This happens. So as was pointed out by Dr. Chitra, we should have natural sources for everything. Everything exists in nature. Thanks.
Plus, it is unadulterated. So the more you have natural stuff, the better it is.
Where do we get the natural stuff? All the hormonal injections are put into Loki and Tori, and they quickly write them and then get banana maybe chemicals laga ke. Abhi aap natural bacha kya hai?
I know. Both we have to live with that. What do we do?
What
Even organic, it's very difficult.
Very difficult. अरे हम लोग खुद भी तो natural कहाँ हैं? सब मशीनी जीवन जी रहे हैं.
वो तो है. But we have to live with that, and we have to bear with it.
Yes.
So,
Dr. Ashwini, thank you very much for the great input. We have to look for the natural sources. Absolutely. The point is very well taken. Thank you very much, Dr.
you.
Chitra. Grateful. It was a great session. I really enjoyed, and I have learned a lot of things. Thank you very much.
Thank you.